Hey guys, Jill from Whole for Life. Happy Monday, Inauguration Day. I am continuing our series on peptides that aren't as widely known or widely discussed. So we talked about PT141 in the last video, and if you haven't watched that, I would encourage you to do so, particularly if you are a perimenopausal, menopausal, or postmenopausal woman, or if you are a man over the age of 50 or have struggled with some function issues and libido. So today we're going to talk about Kisspeptin. Kisspeptin, I have heard more mainstream than I have about PT141, but still not enough good, credible, accurate information out there as far as I'm concerned. So that's the one we're going to talk about today, and I'm actually going to read from you one of the comments that I got multiple times over across all the platforms was about clinical studies, clinical trials, and things that had been done about that, and what some of the findings were with that. So I'm going to read from some of the clinical trialing data so that you can kind of have an idea of what Kisspeptin does or potentially can do, what it's for, clinical indications for it, that kind of thing. I am not your doctor. I'm not anyone's doctor. I'm not here to diagnose, treat, or cure you. So please keep that in mind. First of all, let's talk about infertility. Certainly, this can be a huge and quite useful tool in the world of infertility. It does have some potential to regulate reproductive hormones. So hormone regulation, and again, that doesn't necessarily have to be for somebody that's trying to, that's dealing with infertility. That can be for a variety of reasons. It can be for, as we change with our hormones, even younger, we're changing. Our hormones are always fluctuating and changing, or perimenopause, as we age, that kind of stuff. And then I'm going to read from one specific trial just because I think it's very important that, and I don't want to miss anything, but I think it's important to get that information out here. So these are some of the findings with Kisspeptin. Increased sex hormone production. Hopefully I'm not going to get banned. I'm trying to be careful with the words I'm using here. Enhanced fertility in men and women. Improved reproductive hormone balance. So that's the hormone balancing I was talking about. Regulating hormones and that sort of thing. So especially if someone is, let's say they don't want to go the route of hormone replacement, they don't want to go the route of even bioidentical hormones, this might be a good option for them to think about. Improving quality and quantity and motility as it pertains to men. I have to be careful here because it will get banned if I say exactly what I want to say about that. But sometimes if there's infertility issues and it's on the male part, or the then it increases all the things that typically are the problem with that. Supports carrying a healthy pregnancy. I think that is very important to note, because sometimes the issue for men and women is not that the woman cannot get pregnant, it is that she cannot keep a healthy pregnancy. So it has been proven in several clinical trials and a lot of data to support that it does support healthy pregnancy to term. Reduce stress and anxiety. That's just a happy side effect in my opinion. I don't think this is the peptide that I would reach for to start with if I were just managing stress and anxiety, but it certainly can help with that as well. Enhance libido and desire, absolutely. It is a hormone-free fertility boost, so for those that don't want to explore that, or for some other issues that women and men across the board may have had where they had some hormone-driven problems in the past, this would be an option for them that would not elicit or require hormones. And then, of course, the fertility boost. So those are, and again, there's some other great benefits of Kisspeptin, but I wanted to list off and read off to you very specifically what some of the clinical data had supported. So I would say this would be the peptide to consider. Again, I'm going to always tell you should work with a trained professional who is either credentialed in peptide therapy or at very least has had some training in that. But this would be the peptide that I would look for people trying to balance hormones naturally or without hormone involvement, like hormone replacement involvement, things of that nature. I would use this for infertility, absolutely, and it would be a secondary or a backup for libido as well. And then, of course, all the other things that we mentioned. So that's Kisspeptin in a nutshell. There's much, much more information I can talk to you about how it works, the mechanism of action, how we would deliver that to the body, the frequency, the dosing, all that stuff. But this is just general information, trying to get some info out there. We will eventually get around to the GLPs, peptide only. I'm not here to talk about drugs, but we will get around to talking about the peptides for GLP, for some of those other things, muscle building and that kind of stuff, repair, pain, nootropic, or cognitive brain function. But I wanted to start with a category that I don't hear much out there about, and if I do hear it, it's not credible, not correct information. So again, I will express in every video that we do about peptides how you can go about talking with us about that and then starting on your journey. That does require a peptide consultation. We have opened up some more spots for that, and typically you're able, as soon as you contact us, we're able to get you in that week, or at the very latest the next week for that. It is most of the time, it can be done by televisit or in person. It's 30 minutes or less. Usually it's 15 or 20 minutes. And then we will determine what would be best for you, give you all the options, all the information, and go from there. If you are out of state or if you are not local to us, we can certainly ship everything direct to you, including your supplies. If you are not, if you are local, then you're welcome just to stop in the office. So, hopefully that will help. Like I said, the first video was PT 141. If you haven't looked at that, you need to. And then the next one will be this, Kisspeptin. And then we'll just carry right on. But my goal is to talk about the ones that most people don't talk about first. So I hope everybody has a great and happy Monday.